Amiodarone, cortisone, is the prototype potassium channel blocker. It has vasodilating effects and decreases systemic vascular resistance. It prolongs conduction in all cardiac tissues and decreases heart rate. And it decreases contractility of the left ventricle. Because of its long half-life, loading doses are usually given. It's used for various types of life-threatening tachydysrhythmias, both ventricular and atrial. The oral form is usually given to treat recurrent ventricular tachycardia or ventricular fibrillation and to maintain an NSR after conversion of AFib and atrial flutter. The IV form is given for acute suppression of refractory, hemodynamically destabilizing ventricular tachycardia and ventricular fibrillation. Drugs that interact are beta blockers, oral anticoagulants, digoxin, and phenytoin. Therapy should begin in the hospital with continuous monitoring and emergency equipment ready. You should assess heart rate and cardiac rhythm. If it's greater than 100, increased vigilance in assessing cardiac status is warranted. And assess ectopy and call the physician. You should teach if the dosage is changed, they will be hospitalized during initiation of therapy. And as the picture shows, you should monitor for progressive pulmonary problems, dyspnea, decreased breath sounds, and cough with rales.